Hello everyone, so welcome back to MRCS-REVISE. Today I'm going to be taking the demonstration of instruments and equipment you would need for the procedural skills part of the MRCS Part B. This is a very important part because most people may miss this part in the preparation for their exam. So come with me, let's have a look. Now the very first thing you want to think about is gloves. Yes, you really need gloves and you need to know what is your size of glove and what type of glove. Now, generally, for most procedures for the exam, you would require a sterile type of glove or surgical gloves. But the examiners may tell you that it is okay to use this type of glove, disposable glove. So you want to quickly know what was the size of glove you wear. And on here, usually in most of the packs, it tells you. So this is M, meaning medium, L, large, XL, extra large, or S, small. So that tells you the gloves, and it tells you here as well. So once you know the size of gloves you wear, so I tend to wear medium or large. So you want to now wear the gloves. Yes, practice wearing the gloves. It's important to practice wearing the gloves. So you want to use your thumb as the lead. So you want to go, squeeze in nice and gently. So it's important to avoid tearing your gloves during the exams, which may destabilize you. But if that does happen, that's okay. Quietly, wear another set. So that's fine. So you've done this, you want to tuck in your gloves like that, and then you want to go ahead, and do the procedure with gloves as indicated. So yes, so that's it. Now, the next thing you want to be aware of is, of course, gloves is a technique for removing them. For the demonstration purposes, we won't go into that. There's two sizes of blade you would need, is the size 15 and the size 11 blade. And there's a technique for opening these blades, and if you go to the top here, you would find there's a flap, and when you pull it outward, you can take that and put into the tray sterilely. But this blade is mounted, and this is the size 11 blade. It's a puncture type of blade, which you usually require for draining an abscess in the exam. And if you look at this end here, it says 11. So that's a size 11 blade. So that's the size 11 blade. Then you do the same thing for the size 15 blade, which is blade for fine work or the plastic blade. Again, you do the same thing, and then if you look at the top here, it says 15, and that's the size 15 blade. So yes, so blades again you would use for the appropriate procedures for the exam. Now, moving on, the other things you should also know about is syringes. So syringes for the exam, most likely you would require only 5 and 10 ml syringes. So we can assume this is 5 and 10 ml syringe. Again, if you look at the end, it tells you where to open, and if you do this, it tears nicely, and again you can open sterilely. Now, beyond that, the next thing I want you to see is on this end, it tells you the sizes of needles you can use. And so if you read on there, the most popular is deep blue, and that's a size 23 gauge needle. It's generally a fairly fine needle. So when you take this, most of the syringes comes with their needle, but if they don't, you look here, the needles also give you the gauge as well as the color coding. And if you look here, it's blue. So this tells me this is a size 23G gauge. This is usually for fine work. So if I assume this is 23 and this is 22, in the procedure for infiltration, I don't recommend that you necessarily need to buy lidocaine itself, but you can use water for injection. So I have one open, water for injection. I've opened this thoroughly. Again, use the same trick. If you go to the end of whatever it is and you peel open, you should be able to get it. Again, you open, you have to handle this thoroughly, but for the purpose of demonstration, I wouldn't be doing that. And then you mount it. So we'll assume that this is 22, and then you fetch the lidocaine, isn't it? You would usually have an assistant in the exam that would do some of it for you. And once you've done that, you have the lidocaine in here. You take the smaller gauge needle and you mount it again. You would have opened and put in the tray. You mount it again, and then you go ahead and infiltrate. So for your practice, water for injection, it's fine. So you need a board where you can practice suturing, where you can practice excision of a mole, where you can practice drainage of an abscess. Also, get your hands used to gauze, cotton wool. Yeah, set up these things, practice with them. Again, you can buy all this from Amazon. Get yourself, create some, simple gallipot and the things you need for everyday procedures from like this was created